Hi guys, it's day 4. We're going to go into some details on what happens when we don't know what else to do. Where do we look? Where do we turn? What are we looking for? So, day 1, we talked about 3 things care providers we should ask the doctor. Day 2, we talked about the things that can go wrong in a tantrum and behavioral problems and the reaction of those. Day 3, we talked about medications. And today on day 4, we're going to talk a little bit about what happens during a developmental evaluation, I guess is what you would call it, more so than a psych evaluation. They're going to gather details on your kiddo. They're going to ask you questions about, like, when you gave birth, how your birth was, if it was on time, early, late, medical history, your medical history, their medical history, developmental milestones, when they started hitting those milestones, like did they walk at 12 months, did they talk at 1, did they talk at 2, how many words can they say. They'll ask you all those important questions. Just be honest, answer them as best as you can. They're also going to observe your baby directly. You're going to be in the room with them. They'll observe them, and they're going to see how your child plays, they behave, how they interact with other people, if they interact with them, if they don't interact with them. And then they take them, sometimes they take them behind the scenes, sometimes they do it in front of you for a more structured type of testing where it's just them and the psychologist, where mommy or daddy isn't involved, because they want to see how your child is going to act without you in the room. So, that's going to be hard for you, but it's okay. They're professionals. They got this. If they need you, they'll come get you. I promise. There's a few other things. They may have you do more of a specialist evaluation with a psychiatrist or psychologist, physical therapist, occupational therapist, speech therapist, or developmental therapist. It'll probably start out with, like, your pediatrician, and then they'll recommend you to a provider that specializes more in developmental disorders and issues, so that they can be assessed by a developmental pediatrician. And then if you need other things such as therapies and things like that, you'll go through some more observations and tests and developmental evaluations with specialties like speech and occupational therapy and physical therapy and developmental therapy, if he needs it. And if they feel like you need any sort of medications, sometimes your healthcare provider will do that for you, or sometimes they'll refer you to a doctor that more specializes in those medications. Sometimes they'll talk about the results with you right there that day. Sometimes they'll say, hey, we'll get back to you in about a week. It just depends on who you went to see first. So if you saw your pediatrician first and then they refer you to a developmental provider, the developmental provider or pediatrician will usually tell you your diagnosis that day, but they'll give you a more detailed report 1 or 2 days later, maybe a week later. It just depends on the doctor and how busy they are. Because if you have any issues that you feel like you need to do a developmental evaluation, start talking to your provider now. Start advocating for your baby now. The sooner you can start getting them in therapies and getting them talking to people, the sooner you can get the help you need and the therapies you need and the backup that you need for you and your babies and your family. Because it's stressful. It's hard. It's tough days. Like I said, today was a rough day. Our little kiddo had a meltdown. Him and sis had a fight. It was rough. We had to do some timeouts. We had to do some restructuring, redirecting. Had to let him cool down. And it took for us, it takes a good hour depending on his day. And he was having a pretty good meltdown. It wasn't a tantrum today. It was a mix of a meltdown and a tantrum. And sometimes you'll have that. Sometimes they just don't want to hear the word no. Then they start having their tantrum, which, typical. We all have tantrums about a no. And then sometimes that tantrum can turn into a meltdown, which gets you the silence. They don't want to talk to you. They walk away from you. So you just gotta try and deal with it the best that you can, and you know how right now. Just also some common things that they're going to look at in these evaluations is like their language and communication skills, motor skills, cognitive skills, their thinking, how they process stuff, social and emotional, how they handle things, and if they need any adaptive help for like motor skills, like brushing their teeth, feeding themselves, able to clothe themselves, things like that. Those are all the things that they're kind of looking for also in those developmental evaluations. So it's a big process. It's a lot to go through. But if you can get in and you can get the answers that you need, it's better for everyone in the long run. And always do the best that you can and keep moving forward and pressing ahead. You guys got this. You're doing great. You're an amazing parent. And here on A Caregiver's Compass, we just want you guys to always know that your health is important just as much as your kiddos. And you're going to be tired and you're going to be distraught some days. And just, you just want to give up. But don't give up. We'll see you tomorrow on A Caregiver's Compass. Thanks for watching, guys. Click like and subscribe. Leave me a comment. Love to hear from you. And we're also going to be rolling out for you guys, hopefully Thursday, a new app from A Caregiver's Compass to help you be able to just write down some behaviors and things and add to your list and help you guys out in the long run. I hope you guys like it. It'll be available on the App Store for iPhone and Android and most mobile phones. So just be on the lookout for that also.